that you are keeping safe and well. And we want to thank you so much for registering for this webinar, a very specialized webinar for NGOs. My name is Ambrose Mugisha. I work with the Institute, the head of education and training. I want to welcome you in a special way. And today we have a lineup of presenters. We have Mr. Herbert Mugumya, who is the chief of party for USAID project. I believe you are able to see the screen where he works. We also have another presenter, Mrs. Flavia Chomukama. Sorry. So she will be joining us along the way. I want to highlight to you that there is a series of webinars we have in the remaining time of the year, and you can get interested in attending those webinars. In case you have more than the required CPD hours or what, you also need to start thinking about how to file a CPD return. You go to the portal, to your member ID, look at online services. After you have put in your password and the FM number, file in your CPD return as you continue learning. Otherwise, I want to thank you. Allow me introduce the chair for our webinar, CPA Clayton Mwaka. Clayton is a practicing accountant with Clayton and Company. Ladies and gentlemen, let's put our hands together wherever we are in this virtual world to welcome the chair for the session. I see that he has jumped out, maybe due to network, but let's now put our hands together to welcome our presenter, Herbert Mugumya. And when he is done, we will also take on another presenter. Thank you, sir. Mr. Mugumya, you are welcome.
Yeah, thank you so much, Ambrose, for the welcome and introduction. Good afternoon, participants of this webinar. Wherever you are located, I hope you are doing well and you are keeping safe. So first, I would like to thank the organizers of this webinar for having trusted and invited me to make a humble presentation about this very big topic. I want to assure you that initially, I was feeling that it is too much, and especially on my side, to provide information that would meet your expectations. But I think through the discussion or the presentation, you will be in position to point out additional areas of information that you might need that I'm not able to provide as I present. Otherwise, I just want to add a little bit about myself so that then members can know who exactly is presenting. I work for Pathfinder International as the country director for Uganda. And at the same time, I work for USAID as chief of party for the family planning activity or program. The two responsibilities are separate, but they are being done by one person. A little bit about my background is that I have been in the non-state organizations for the rest of my career. Since 1990 up to this point, I have been working for NGOs, and I have cut across several of them, maybe about 8 of them. And this is the area that I know very well. We have gone up and down. We have seen the expansion of these NGOs. And therefore, I feel very confident that I can provide you with the information that you do expect. from the discussion, you see that we are supposed to talk about COVID-19. And before we talk about the actual issues that this disease has brought us, I just wanted to highlight to you a few figures so that you can know where we are. Let me see if I can move the screen. Okay, globally, you would notice that the situation is really very bad. As you can see, slightly over 1 million people have died, and this is not good news for the human race. So, and the people have been affected as 37+ million. For this, I would like to let you know that if you can look at the total population of Uganda, we just assume that all of us have the virus, given these figures. But the biggest contributor for the cases and deaths is one country called America, USA, or United States. For now, it has close to 7 million, 7.8, and it has had 215 deaths. This is unprecedented in a first world country. And therefore, this disease is a real one. When we come here to Uganda, you would notice that since it started, we have gone through a series of events. In terms of cases, the cumulative figure is also very scary because we know we have tested 500,000 people, and out of that, close to 10,000 cases have turned positive. The good news is that 6,000 have recovered. Now, between those that have recovered, we still have so many who are in the hospitals or they are at home and they are receiving treatment. The death toll is really not very big or scary, just like other countries, because right now we are close to 100. And on a daily basis, I think we are receiving information that we have close to 100, sometimes some other days we get 150 new cases every day. So the stage we are in is what they consider to be a stage that is very difficult to control, because right now we have community infections that are taking place because majority of the victims do not show any signs. What we call in science, they are asymptomatic. And this is a worrying case because a situation, because then you don't know whoever is around you could be carrying the virus. And therefore it is very possible or plausible that then that very person can infect the next person. So in our daily interactions, this disease continues to move. In fact, for Uganda, there are more infected people than those that are reported. Why? Because several people who are carrying the virus have not tested. And this country cannot afford to have mass testing so that they can establish the actual figures for those who are infected. And therefore, this makes it very complicated. And knowing that even when they want to get as many people into care, starting with testing, they have to rely on contacts. So for the cases that haven't tested and spreading the disease, we do not know the contacts of these individuals. Now, given the fact that the government of Uganda has relaxed on some of the restrictions that were put in place, the virus is able now to move from one place to another across the country without any detection or knowledge. And therefore, this calls for high level of awareness, but also increasing the perception that there is always a risk every day as long as you interact with other people. So this is the situation that we are in. Now, at the beginning of this virus or response, the government put in place several measures, and the president is globally acknowledged and given accolades for how far he has been able to restrict or restrain the transmission of the virus through the lockdown at the beginning that we had on March 20th or 21st, thereabout. Now, over the months, which are now close to 6-7 months, we do recognize that we have gone through these phases. We feared at the beginning, but now the population is relaxing. But when you look at the management, it's the government through the Ministry of Health that entirely has been responsible for managing this response. And I can assure you, even given the social media audios and videos we have received from the ministers of health, they seem to have given up. Why? Because the state resources, even when they are supported by foreign funding, have significantly run out. And therefore, the centers that have been treating patients in Mulago, or even the quarantine centers that were put up for those that are suspected, have been closed. The hospital beds are full up. Right now, what we are having is a policy on home-based care for patients, especially those who do not show any signs and symptoms. And this burden of looking after COVID-19 patients from government to homes is such a huge burden, and in fact, even putting more people at risk, because when you move around the countryside, you will notice that there is too much complacency. Even for families, they don't know who is likely to be having the virus, or even if they have the patient in the house, there is no utmost control or care that is likely to be given by the family members. So this is the situation that we are in. What we are about, or what we are missing, is government being open enough to let non-state actors to provide the support, just as it has been over the decades and the years for the other diseases like HIV, TB, malaria, or other conditions. And this is very, very critical, because we know that Ugandan government or other sub-Saharan Africa or poor countries have not had sufficient resources to take care of their patients, given the disease burdens in different contexts. So for Uganda, it becomes very important that the government opens up. Now, I go to the real issue, because when we talk about the NGOs, for me, I consider them to be non-state actors, and they fall in several categories. I've just highlighted a few of them here. And all these NGOs, they obtain funding either from foreign governments or individuals, foundations, and these funding sources significantly add value, capacity, and resources across the globe for them to be in position to do what a government would otherwise be doing by contributing resources in several ways. And this could be money, it could be expatriates, it could be equipment, it could be medicines, it could be any form, whether it is in cash or non-cash or in kind. And for that, all these non-state actors or NGOs, this is what they are supposed to be doing. However, a disease that comes in this kind of magnitude, that spreads very fast, that threatens the status quo, where even the source of funding is highly affected or more affected than the poor country, which is supposed to be a recipient of the support, then it becomes very difficult on how, in our context, we are likely to survive through, because we have not reached the peak of the infection, and we cannot know the scale at which we are likely to move. And we just keep praying that people take preventive measures and we don't reach an escalating situation in which our governments cannot afford either to provide support or sustain the response. So in our case, I am putting here a few examples for those disruptions, what you would call the impact, positive or negative, that this disease is bringing to us. I will give few examples, and these examples will not dwell too much in data, simply because even when I'm here in this organization implementing a program, it is very difficult for us, given the confidentiality clauses that we have in our agreements, to provide data, and especially to a public or open forum like this one. However, I just want to state that any disease that comes in addition to the existing one provides a challenge of resource flow. Now, for a program or programs that we're implementing in our country portfolio, we see that there is some reduction in the expected funding that would take us through this year. Why? Because the source of the money is also affected by the disease. And therefore, they take first priority to look after their citizens before they consider giving this money to non-citizens and across the globe. And for that, because our major source of funding is through the US government, we continuously implement the programs for which we are contracted. But at the same time, we are supposed to ensure that our staff, the people we work with, our clients out in the community are safely protected from this disease. And to do that, it requires additional resources, because the resources that we are using are specifically earmarked for the activities that we put in our work plans and those work plans that are approved for implementation. And therefore, we start what we call leveraging resources from the existing programs in order to complement government efforts on COVID-19 prevention. And I can tell you, it is a little bit challenging. In Uganda right now, for an effective health workforce to be protected, it requires significant money in order for them to have what we call a complete set of PPEs. Now, this personal protection equipment does not come cheap in any way. And that's why you see, for those that have been affected, the health workers that have been affected, we have lost some of them in Kapchorwa, in Mbale, in some of the eastern districts of Uganda, and I think 1 or 2 cases in Western Uganda and around here in Kampala. I don't have the exact figures over my fingertips. And this is very unfortunate, because then if a disease claims the person who is managing other 6 patients, then it becomes even more scary. I wish this government could have allocated more resources, even from food items and other things that they were distributing, to ensure that health workers are protected more than anything else first. Then they can start doing additional work. But as we know, this hasn't happened. And we pray as NGOs that the government can see this light. The way the resources are shared or planned or budgeted at the sector level, trickling down through the sector to where the patients are, I can tell you those guys are struggling, and we move out to these health facilities every day, and we know what they are going through. The other disruption around this is even within the health facilities, there are other patients who need support because they come in with malaria, they come in with HIV, they come in with TB, they come in when, like women, they are pregnant, they want to deliver. There hasn't been any training of health workforce that is specifically focused on COVID. So what is happening is that these existing health workers in all facilities do what we call task shifting. So some of them are moved away from what they would otherwise be doing on their normal routine to start covering up or providing support for COVID. And this is an additional burden for which even limited resources are available to offer them as allowances. And this becomes a huge burden on their part. And I'm not talking about the other social impact for all health workers who are directly in touch with COVID-19 patients, and when they go back home, they receive stigma from their own family members or the community because they know they are interfacing with COVID every day. So the social stigma is actually impacting more heavily to health workers than the disease itself. So this is very critical, and it is an area that social scientists must look at. The second point is about human resource exchange and learning. To us in the NGO sector, and especially for international organizations that have multiple programs globally or across countries and continents, they require some of their staff to be providing technical expertise in different countries. Right now, we are challenged. These experts cannot move from one country to another because of the disease. Why? Because their home countries, they are anxious that perhaps if they come to countries where there is relaxation, like the situation we have in Uganda, then they are likely to be infected. And because they have higher death rates, they are not likely to allow their people to come to this situation where they are not even sure of the health systems in terms of managing and treating COVID patients. So in a way, we are missing out significant capacity for the work that we do, where we are supposed to be receiving support. We are not even allowed to travel outside the country or to our home offices or headquarters in America and other places, because then even our own organization would say, we are not sure if you come to us, you won't be infected, because they seem to be having more cases than us anyway. So the whole situation where you would have people moving, having this cross exchange of learning or providing capacity and support, it's not happening. The other point around this one is that the traditional norm of our staff working out of offices has also stopped. We work from home. I do the same every day. I work from my home. But at the same time, I'm supposed to see that all my staff, who could be 100 plus, are out in the field doing their normal duties, normal in quotes, but ensuring that they are protected and they are safe wherever they will be going. That is also not very easy. So the impact of this is that you have such a workforce that is scattered across different spaces, expected to be providing essential services to Ugandans, but something that you cannot quickly provide a hands-on because you rarely interface and we only communicate through Zoom. A few skeleton staff only stay in office, provide backup support like finance, travel, and all those things. What this collectively go or impact on is on our economies. The families that are having patients or have not effectively been economically active because of the restrictions will definitely find it very difficult to cope. And we have seen, I don't have the figures for the Minister of Finance right now, but I think you guys who do a lot of work around finance, you can get these figures better to see what the government is losing in terms of either inflow of resources at national level or regional level or household level. And I know for sure that so many families that had very good income sources out of their productive investments, they have found challenges either in marketing their products or in trying to get inputs that should be helping them to have high yields if they are in agriculture. So we are seeing a graph, a nosedive in income at family and at national level. If this economy cannot have, until yesterday when tourists were allowed to come in, then you would understand what it means by having money in our economy. But leave alone that, even for some of us who do business, it's very difficult to go through the logistics of importing. It takes more time to receive your goods because you can hardly travel out of the country to select the things that you would want to do or to trade in. So that impact is so big on some businesses which are reducing and some have collapsed, or on how they can sustain what they are doing with the limited goods and services that they have to offer. For those that were involved in consulting work internationally, this is something that is challenging because they can hardly move. I have a colleague who has been stuck outside the country where he was doing consultancy and he cannot come back. And for the last 6 months or so, he has been staying there. Now, when you move to employment, of course, it goes with the rest of the economy. If the economy is not performing, if those who are businesses are low, if those who are supposed to receive funding to implement several things are not doing so, so we get unprecedented unemployment rates. Uganda is not very good at tracking employment rates. I wish we would be getting this from the Ministry of Labor, but we do not get as such. What I saw around me is that even those that had gone out of the country seeking employment, some have returned very recently, others are still stuck there, but even those that have come back, because of the restrictions, they are not willing to go back. And you will see this for those people that are closely related to you, and you will notice the impact it is getting. I would have talked about education as another issue, because right now, as you look at education, even if we have graduates coming out, the space for them to start economic work, economic gainful work, is what is challenging. So the more people graduate, the more they are likely not to get employment, the more they are likely to stay unemployed, the more worse situations that they are likely to be going through. Even when the government says we can stop for a year, when they open up, it will still be the issue. You will have all these huge of numbers of people graduating, but then employment becomes. However, for NGOs, if government allowed us to take on this disease the way we took on HIV, the way we took on malaria or TB, I can assure you there would be more proposals written as a mitigation measure to access additional resources that would directly come to our communities to support the scale at which the transmission is happening. But right now, we are not getting, or we are not having that opportunity. There is no single NGO in Uganda, as an example, that has been funded solely to support COVID response. I have known a little bit in Kenya, where US government provided additional funding, and my organization was a recipient of a small grant, but it was also very small. So given the president and the government good work they have done in advocacy, in education, I think if they opened up to say that now we can solicit funding to complement their work, it would come in handy. Number 5, I wanted to talk about all these diversions leading to global diseases because of COVID. As I said, because I talked about it at the beginning, that we are leveraging existing funding to support or cover up gaps in the COVID work. The last point, I've also talked about it a little bit, but it is one of the most scaring issues that we have right now in Uganda. Our health system has always been weak. With COVID, the situation can only get worse. Now, the systems of health are diverse, but the few that we know that are so critical and is the health workforce, for the number of health workers that we have that can cover up care for every other disease, including COVID, which is an emergency. The other one is the medicines that would be required. The other point would be equipment that is necessary. Because as you can imagine, if you go to Mulago and you see the units that have been put up for ventilation, especially those patients that need oxygen as they come in, they are not enough. Even when they set up Nambore, you can go there and see whether there has been supportive equipment that is necessary. So if you cannot protect a health worker with the equipment they need to be safe, then it becomes very difficult to imagine what would happen if every situation has to be like that. Everything in the health system requires money. If money is not enough, then everyone becomes risk. Why? Because those who should be helping you will not do it because they expect to be funded, facilitated, or in any way that they need to do their job as expected. So, how are we coping? Our coping mechanism is very limited. Our support is supposed to be going as NGOs, especially at district level or community level. As I indicated, this is very limited, but we have tried our best. We have worked very closely with the Ministry of Health, come up with guidelines, and these guidelines are helping us to offer essential services. But the essential service package is usually very big, and you cannot have everything in that given the resource envelope. But I know we are managing in some way. Why? Because we do not want to shift too much focus on COVID that seems to be killing less people than the diseases that we know that have killed us most. So if we are dying so many numbers of people under cancer, under HIV, under malaria, under TB, women who are delivering and dying during delivery, or children who are dying at birth, and these have been the conditions that really affect us most, then for us who are in the front line and having resources to provide the support, we think we have to ensure that our normal that we have always done every day is okay. Then we can add on the additional responsibility or the impact that COVID is giving us. As I indicated, we are leveraging resources in the existing projects just for the current sustainability. And we can move this for over a year, by the way. And we hope that all NGOs that are receiving funding stay the same. If it reduces and continues to reduce, then that even impacts on how well we have been doing on other diseases. And this is an issue. Remember, for the upscale families, the high-end people who have their own money, and they should be traveling outside the country, as we have always known, to receive treatment. These guys have not been going out. So they are also sharing the same resources to receive the best health care from the existing health system that doesn't seem to be doing much better. So we'll find the rich trying to take space of the poor, because originally, without COVID, they would travel out, but now they are not. I saw in the papers yesterday that the government has been able to save millions of dollars for the government officials who would have otherwise traveled outside the country to receive treatment, but they didn't go, which means the international travel, they have saved money. But no one knows whether that saving has really gone into the COVID response. And this is where the situation should be working out best for us. Just like in other countries, Tanzania, Rwanda, they have picked up very quickly and improved their system out of the saving of resources that would have gone outside Uganda, where they seek treatment abroad. We are also ensuring and safeguard essential services for the vulnerable groups. During the lockdown, we were hard hit by women, girls, especially not accessing health facilities to obtain family planning, as an example, or get safe deliveries at health facilities. We now have an increased teenage pregnancy because all we know and the evidence that is available is that our families, our homes are no longer a protection for young girls not to get pregnant. We have proved that schools protect our children more than our own homes. And therefore, we want to make sure that our programs extend in communities and ensure that all the adolescents, young people can access reproductive health services as and when they need them. And we are doing this. We have invested a lot of money in telemedicine, in home care, in awareness creation. We are doing this sometimes virtually, or at times ensuring that there are some staff who can extend out of facilities some services to people in the communities. And this will continue. We had hoped that the government would approve the strategy of providing community health extension workers, and it looks like this is something they have gone slow around because they do not have significant resources for a robust community health system. Nonetheless, we continue to do our business as usual, and we think some more souls will be saved. Hopefully, once we are getting through this, the health system, the way it is, it does not get worse, and that, for example, all the medical schools will be able to graduate people, and that becomes an additional health workforce to the existing people that we have. Or that then the economy will slightly improve now that tourists are coming, so that we can get a lot of resources, part of that can go in our healthcare system. Or that the government will relax a lot of restrictions around importation, because then traders need to bring in things, those that would help us to earn revenue on taxation, or even to do some export once the international export system is up and running again, because now more planes are able to move. So in that, we think by doing many of these things, then they would help a lot. One, more people getting a little bit of jobs, and then having additional income at household and personal level. And this income goes into the system, in the economy, that would help the country to stay afloat. These current political waves that we are having in Uganda, in Tanzania, because they are voting, I think, at the end of this month, are not doing us a favor. Why? Because funding that would otherwise be going into health sector because of COVID is diverted to support the political expenses. And this is the challenge. I thank you so much for listening. I would stop here and welcome your comments or questions. Thank you so much.
Thank you so much, Mr. Mugumya, for the wonderful presentation. And we thank you for the key insights you've given us on the impact of COVID-19, sustainability, social impact, and service delivery. We now request for questions. I encourage you, participants, to post your questions or comments in the Q&A. Then we will read them for our presenter, who will respond accordingly. So kindly post in the Q&A so that we are able to know your views and then respond to them. Thank you. In the meantime, we will share the videos for this webinar via your emails, and also on our YouTube channel. You can go and get that video. We also share the certificates through your email address that you gave us while registering for this webinar. So please take note of those items. I thank you. Herbert, there are no questions yet. Let's give participants a few, maybe 1 or 2 minutes to type in their comments or questions.
I would be happy if the questions come into the chat box, then that helps me to read properly the intentions of some of the people they have.
The chat, not Q&A.
In the chat box on Zoom, there's a chat box.
Okay, but we would like them to post them in the Q&A tab.
Oh yes, it's the same. Yeah. So fine.
Thank you.
Okay.
Yeah. It appears there are no questions. Allow me introduce the next presenter. The next presenter is Miss Flavia Chomukama. Flavia is a professional teacher, but also a human rights and gender studies advocate and activist. Flavia is currently executive director of Action Group for Uganda for Health, Human Rights, and HIV. Flavia is a founder of National Forum of People Living with HIV in Uganda. Let's put our hands virtually wherever we are to welcome our presenter, Flavia. Thank you so much. Flavia, you're welcome.
Thank you very much, the viewers and participants in the webinar. Already introduced as Flavia, and I work for Action Group for Health, Human Rights, HIV, and AIDS, an organization that has lived for 17 years, and we do a lot of advocacy around sexual reproductive health and rights, but we for health financing for sexual reproductive health. So our main work is budget advocacy, but of course we do research to get information on what communities want. So my task is to talk about the implications of the NGO of the COVID-19 to NGOs. I'd like to first say that as NGOs, we come into play to fill the gaps around inequalities that are in the communities. We also try to enhance social cohesion. We engage in human development, providing services around education or health and so forth. But we also come particularly in the area that government doesn't normally work around, that is around rights fulfillment. So we come in terms of trying to address those delicate issues and matters that government doesn't seem to take interest in. For instance, if you look at domestic violence, you look at sexual rights, and also, you know, there is a lot of insecurities in communities, and some of these insecurities government has not given them due diligence and prioritization. And so COVID-19 came, and it has posed a big social and ethical and legal question to us, and it has further exacerbated the challenges that I have talked about. And so as NGOs, we have had to immediately, you know, NGOs move like the wind quickly. You come up and take on the mantle as it comes. So we have had to redesign our projects and also initiate pilot projects to see how we can work during lockdown and now when we are under lockdown. We have had to rapidly change to the new circumstances by engaging in IT and using the scientific kind of collaboration and engagements, and also meetings. And we have done assessments to see what is happening on ground. On the level of the NGO, maybe leadership and governance, we have had to redesign and to replan, start coordinating and collaborating widely to ensure that we can reach the communities that we have been reaching. So what is it that we have done? As NGOs, we have tried to look at the livelihood area. And during the COVID lockdown, we quickly came up and started mobilizing little monies, some food to give the communities that we serve. I personally live with HIV, and a number of us have HIV, and at that time when we were locked up, people could not actually reach the health centers. So we came up with groups, online WhatsApp groups, and we agreed, what do we do? We actually agreed to collect money and support those who might need services, and also we ensured that there was somebody we could delegate to deliver medicines to the house, to the doors or centers near the communities where people are living. We also, during that time, ensured that for people to adapt to this COVID-19, we were part of those committees. We had a lot of advocates around being part of the district task force teams, because we had to make sure that our voices are heard. And you do recall that task force teams were made by and compiled by government departments mainly. So civil society was not there. So we started pushing, and indeed in some districts we were able to get people there. At national level, we forced our ways into Ministry of Health activities, meetings and planning meetings for COVID-19 response to ensure that communities are not left out. And you do realize that during such hard times, NGOs are points of reference for people, and especially this pandemic. We did a lot of sensitization. We did a lot of education about what is happening with COVID, how can we prevent it, where can people link. We even opened helplines, and people were able to link up and tell us their problem. We did online counseling. We even opened some shelters for those who are being violated or those who are unable to get support from anywhere. And we were providing food for people. So as a point of reference, the community is very proud of NGOs because we are very near. We are able to listen to them in the language they understand, and we also feel like them because we are from there. We also decided to reconfigure ourselves to ensure that we push for new backing and supporting the medical and health systems. You believe you realize that government works well if it has some community systems and structures in place. And this COVID-19 was the litmus test on whether we have ready medical health services and infrastructure in the country. And I will tell you the answer is no. Because when it reached serving for communities, apart from medical emergencies which were being provided, the other medical services went to a decline. It's as if we had said all the other diseases have disappeared, all the other social services had disappeared, and the only thing that was happening was COVID-19. But even the COVID-19 support and to the families and the quarantine, you remember what was happening around. So we did create an energy around us, NGOs. We got a means and ways of moving around. We got a pass, and several NGOs were able to move around and provide the services they were. But I also do know that many NGOs were failed. They were barred from working because they were unable to get the passes or even to move from one place to the other. So key to this is that we partnered with many people, local and international, and we got some emergency donations. The government had said it was going to bring food. The food went to maybe thousands of the population of Uganda. Many people never saw food. So we also did a lot of support at home. A lot of nursing was required, including mental health, depression, because people were not used to being alone, and also families, homes, men and their wives were now together because they had no work. They had been stopped from work, and it was a big test on families. And you have had a lot of violence. You have had a lot of sexual reproductive health. Sexual defilement and rape and fights, murders. So we were coming in to talk to people, to communities, to families who were near us on phone, physically, or even walk to places to ensure that we try to save the day. Of course, it wasn't easy. We couldn't manage the whole community because, of course, transport was a little bit difficult, but also resources to provide all these services were not enough. But we did what we could, especially for the most needed that were with us nearby. Around health, like I said, we built on the differentiated service delivery model, and we got people to ride bicycles, to get the cars who had passes to be the ones to pick medicines and deliver. But of course, some medications were not being given, or some services couldn't be provided because we didn't have that facility or experience to deliver certain services. So we had to refer or even transport people to the health centers. At the health centers, you'd find no people, children at home, they are all over. There is no education that is going on. There is TV, the TV programs which we were told about, they were happening, but mainly on TV or on radio. How many communities have, families have radio or TV? We were promised radio and TV. We have not seen them. But some TVs and radios have endeavored, and some people were sending some pamphlet for families to give to the children. However, for me, I'm always a positivist, and I always think that every bad situation has a good end. For me, COVID-19 gave me a time to rest. NGOs, we work like donkeys. We never have time to rest. I had 2 full months of rest, and it gave me a time to rejuvenate and to rethink. The other thing I would like to say about the COVID-19 and what it has done for us as NGOs, it has helped us to change our way of work. We are using the media, we are becoming a little bit more competent in IT, and also to work away from the office. It's not like you have to be in the office to be productive. We saw ourselves working at home and making a difference. It also awakened us to the fact that at any one time, a pandemic can come and we are locked down. As individuals, as NGOs, we have to look around and re-strategize on how to be ready, on being prepared, on being resilient, and ensure that we don't disappear with the pandemic. And so what has been the constraints? I think I was talking about them. Already we have shrinking civic space. You know, the NGO Act has very many limitations. We know the Communications Act has limitations for us. We have a lot of increasing restrictions in the government of Uganda. And so COVID-19 is even worsening the space because you are not even allowed to move out to share what is happening. You cannot, if you are to go, you know, you have to follow the SOPs so that you are protected. And to date, we are even faced with the issue of the political gatherings. People can even think you are doing politics when you're actually doing other social community work. And we also see that as NGOs, we have been encumbered with many cases of needy and vulnerable persons and communities at our doorsteps. And yet we have been limited. Even what we had planned to do had to shift to provide livelihoods, food, shelter, you know, medicine, aside from the other empowering things that we had been doing. So we have gone back to almost, like if we had gone 70%, we are back to 50% in what our achievements had been. So we still have to see how we work to ensure that these, like for instance, the erupting of a lot of gender-based violence, the defilement, the abuse that is coming from the community, and with limited support. Like for instance, in my community, there's a neighbor who is been stigmatized. But when he went to police to say that somebody is abusing his child for being HIV positive, the police didn't do anything, the LC1 didn't do anything. So how do we, within this COVID-19 awareness, given the challenges, how do we move forward? So for us, the way we think we can move forward as NGOs to ensure that we continue to participate and bring up the needs and the issues that communities are encountering, provide, like we have been doing, the basic needs and emergency support that we can within our resources. We can also work on seeing that we put in place services. I said we have shelters, see how to work within the shelters to provide mental health support, provide livelihood, provide linkages to ensure that people are empowered. Once they get out of the shelters or out of the sad situations, they are empowered to do, they have some skills that they can take away. We also would like to say and underscore, sorry about the background, I'm in a hotel and where I am, people are passing and shouting, but I'm about to finish. So we underscore collaboration and networking with everyone. Like we saw that we had to collaborate in order to make a difference during the lockdown. The neighbors became neighbors. They are no longer those gates that we locked and we didn't even support anyone. It showed us that we can actually be a social community which is supportive. Those high walls mean nothing because God has shown us that really God is almighty for those of you who are believers. And then we need also to build on the differentiated service delivery models. We have always looked to government to do everything, provide the social services, to provide the health, provide the education, but we have realized that government is also very limited unless it works with communities. There must be a system that is very clear and supportive. And I would say that the Department of Gender, which was not mentioned a lot in the task forces or even the whatever we were discussing. It's a critical ministry that requires financing, particularly to look at what do they call it? The preparedness, disaster preparedness, because it looks like we were never prepared for this, but now it is time to give more funds to the ministries like Ministry of Gender, which are very important in managing disaster. We also need to invest in community resource persons. We had many people who volunteered to do the work, with or without money. People were walking miles and distances. Selflessness is still important as we do the work, whether as individuals or NGOs or partners. But above all, we have to work with government, and government has to be open to see that NGOs are not restricted like the restrictions that are coming up all this time. Give us space and give us time on your table to tell you what is in the community, because we are there and we know what is hurting other communities. So we shall continue to identify partners in and out of the country to fund the priorities for NGOs around the areas that are rarely or not given due attention by government. But above all, we shall continue to talk about financing for the social sector. It is very, very important. And with that said, I would like to stop there and call for any questions if there are. Thank you.
Thank you so much, Flavia, for those useful insights. And thank you, participants, for being very good listeners. As I said, I encourage you to post your questions or comments in the Q&A tab. We have a couple of questions. I'll start with Julius Okilia, CPA Julius Okilia. Julius is asking, centers for managing COVID-19 have been closed because of lack of resources, and yet the infection rate is increasing. The children are coming from communities where there are many contacts, and there will be no social distancing when it comes to time for sleeping, ventilation problem in dormitories. I think he's meaning children of the school-going children who have part of the students who have gone back to school. Don't you think that the government has erred in opening schools, knowing very well that the infection rate is increasing, yet there are no resources? That is a question from Julius Okilia. I encourage you participants, and I will be happy if you specify the kind of the particular presenter to respond to your question. The other question is from Jamila Nankumbi. She's asking, why is it that these days you no longer send us training presentation? Yes. Jamila, we will send you the presentations via your email addresses. By end of Monday, you should be able to receive your presentations in your email address. If you even visit your email address, you should be able to find a certificate. Yeah. So Flavia, I don't know whether you're able to respond to that question as we wait for more other questions to come. Thank you.
Can I quickly answer the first question?
Yes.
Thank you very much.
Flavia, we can give you an opportunity to have it. Yeah, thank you.
Yeah, because I just want to...
It's okay, let him go ahead.
I want to leave the meeting.
Okay.
But I just wanted to ensure that, because not many questions have come through, but for this one, at least I can provide the answer. I have also typed it. But the most important thing is to acknowledge by everyone is that the virus is here to stay. We have been in the emergency mode. We have been freaked, frightened, but along the way, we have started now coping with how we need to protect ourselves. So we cannot stay in hiding, in lockdown. We have to go out. This is not the first virus that has attacked the human race. Several of them have been around, and none of those have we had ever in a lockdown. Ebola was even more lethal, and we have been able to go through it. The most important thing right now is how do you make everyone raise their perception of risk high to live with the virus. We don't have a vaccine, and we cannot keep in hiding. Whether you lock up children in your home, the virus will find you there. Whether they are at school, they need to know how to protect themselves. So the whole instance and this scare, I even divert away from what the president is saying, that he's not allowing children to die. We have had people exposed to the virus, but how many have died? The death rate is about 1%. So the whole point here is, let's learn how to live with the disease. And by that, everyone will cope with it, and we shall continue with our lives. We cannot hide anywhere. The donors or the countries that manufacture vaccines, they are doing a lot, but they will start with their own people. We can be, where we can have the tests done. But the first thing is, America will not allow its 200 plus million people first. They will not allow their people to get the vaccine last. They will need to make sure that any effective vaccine gets their population first. But what will be happening to the rest of us? Avoiding, trying to protect ourselves, ensure we prevent it, we don't infect others, and we continue with our lives. The world is not ending just now because there is the virus. No, we just have to continue living with it. We have done so with the rest of the viruses. So this one, we have again to learn with it. Thank you so much.
You're welcome.
So thank you very much. I could even attempt on the first one. I think government has done right, but also erred one way or the other. Done right because indeed we shall not continue locked until eternity comes. A virus which is spread by a cough or flu can never be controlled. Even if you keep people in the home, they will always get it. Like one of the political leaders said, who is a doctor, he said that we just have to be prepared on how to prevent it. But to think that we are going to be hiding in our houses, and yet we are not even hiding. Go to town and see what's going on. So the other thing I was thinking is that already people are constrained financially. Why open parts of the school? Why don't you open the whole school, or you kill a year like Kenya did? I think they made a good decision so that people get composed and then start a new year afresh. We would have called 2020 a dead year, and then we start next year, because then we would even be aware. We would have done enough tests, and we know how far the magnitude of the COVID in the population and know how to deal with it. My battery is running low. About the presentations, thanks Jamila for asking. I would like to say that I was given this duty yesterday. So, and then I had several things to do. In the morning, I couldn't make a presentation, and when I asked my subordinate to help me, I didn't like what had been presented. So, of course, I'll take time to do a presentation for you and share with Ambrose and team so that it can be circulated. Thank you.
Thank you so much, Herbert and Flavia. There is another question. There are two, actually, one from Julian, directed to Flavia. It says, thank you, Madam Flavia, for the great presentation. Could you please guide on the area coverage of your organization in the country currently? Then the other is from Wanyama Francis. It says, NGO world is changing with many challenges on board, especially resources, stroke funding reduction. How can they ensure they are going concern? I thank you so much. How about you could answer this of going concern, and possibly we allow you move to your next task. Thank you, sir.
Hello, maybe I can get in.
Yes.
Aga works. My God, my battery is off.
Okay. Flavia, is your battery off completely? We have lost you. Oh, sorry, we've lost Flavia. Yes, I may not be in position to answer Flavia's area of coverage for NGO, but for the question from Francis Wanyama, ongoing concern, I believe NGOs have got very strong policies and governance, risk, and so many other, which are all hinged on sustainability. and I believe many have gauged on how they intend to continue as a going concern. Recently, on 2nd October, we have an engagement with Humenta, and most of you were a part of us, and this question came in and it was answered in that way. The whole deal is risk management, how you can diversify your sources of revenue and ensure that you continue providing the service to the community as it is desired. That's how I can be able to answer. I want to thank you so much for your good participation, and I want to briefly highlight you the webinars that we have next. I believe you are able to see them. We have Islamic banking and finance, the new concept. Even if you are in NGO world and you are basically in NGO, you need to know more on what is coming on Islamic finance. You might have a donor whose product is connected to the Islamic financing product, and you need to know that. Then we also have the customs management webinar on Friday, 23rd of this month. It is very pertinent that you know how COVID-19 has impacted customs management and the developments that are being done to have a continued customs flow of goods and services, as well as people. So you may need to get interested. We have a team from URA who will facilitate on that webinar, and please, you are invited at 2 next week on Friday. We also have a data analytics webinar, and the members, my friends in finance, audits, and the others